Welcome in to the One South Coast Chamber podcast, the official podcast of the One South Coast Chamber, serving the business communities of southeastern Massachusetts. Today, I'm your host, Ian Trombley, Vice President of Public Policy, and today we're doing a Policy Pulse edition, an episode where we will discuss different public policies and the impacts they have on the business community here in southeastern Massachusetts. For the first edition of the Policy Pulse, I'm thrilled to be joined by our very own state senator, the senator from the First Bristol and Plymouth Districts, representing Fall River, Freetown, Somerset, Swansea, Westport, Lakeville, and Rochester. He is the chairman of the Senate Ways and Means Committee, a member of the One South Coast Chamber, and my good friend, Senator Mike Rodrigues. Senator, thank you for joining us today.
Great to see you, Ian. Thank you.
Thank you so much. So have you ever been on a podcast? Do you listen to podcasts?
First time.
First time on a podcast. Do you listen to them?
Occasionally.
Yeah?
Occasionally.
Yeah, it's one of my main sources of news these days. It's, you can listen when you drive, you can listen when you're on the road, doing errands, whatever you need to do.
Well, and I think it's important because you hear firsthand from the deliverer of the information as opposed to secondhand with somebody interpreting what that deliverer said. So I think it's,
completely agree.
Directly from us. Yep.
So for this first episode, I would like to keep it, at least start off pretty high level, kind of an introduction to state government 101. Like I said, this Policy Pulse edition will focus on different public policies and kind of the interconnection between government and business. But I figured no one better than you to kind of kick us off and start off with like a basic state government 101, the three branches. You want to tell us a little bit about
Absolutely. Well, thank you very much. Yeah, so our state government is governed by the Constitution. The Massachusetts Constitution is the oldest continuously used constitution in the world. Our U.S. Constitution is actually based upon the Massachusetts State Constitution. We do have three branches of government. We have the executive branch, which is led by the chief executive officer of the Commonwealth, or the governor, and she has under her secretariats, her agencies, her departments, and they are the administrative branch of government. Then we have the legislature, of which I'm a member of the Senate. We have two co-equal branches of the legislature, the House and the Senate. There are 40 members of the Senate. Each one of us represent about 175 to 180,000 constituents. And there are 160 members of the House of Representatives. Each one represents about 45,000 constituents. And then, of course, we have the judiciary. The judiciary interprets state law, serves as the impartial arbiter when there's, whether it's criminal or civil situations to interpret and enforce state laws. In all of these the whole design, the brilliant design of the state and U.S. Constitution is a series of checks and balances so that the power of government, the power of the people, do not reside in one particular individual or one particular branch. Doesn't reside in the governor, doesn't reside in the legislature or the judiciary. There's a series of checks and balances, and it served us well for hundreds of years now, and we're very, very proud of that.
Oh, that's great. Thank you, Senator. And kind of in that same vein, one of your main jobs is, of course, passing legislation. Can you tell us a little bit about the life cycle of a bill, how it comes from just an idea, pie in the sky, to, written in the books?
Yes, it's a long process. We like to call it deliberative. But an idea starts by, could be a member of the House of Representatives, could be a state representative, could be a state senator, it could be an individual citizen of the Commonwealth. They put that idea in writing and petition the legislature. It's called a petition at that point. The petition gets accepted by both branches of the legislature, the House and Senate. It is now a bill. Every single bill, and there are close to 7,000 bills filed every legislative session, every single bill gets a public hearing where any member of the, you don't even have anybody, any citizen can come and testify before the legislature on why this bill, passing it is a good idea, or passing it is a bad idea, or it's a good idea but needs some changes and some amendments to make it better. It goes through the committee process. It eventually gets reported out of committee, and then it is deliberated by the full branches of the House and or Senate, depending on the branch of origination. It then goes to the other branch. It gets passed by both branches separately, usually in two different forms.
Yep.
A conference committee is established to rectify the differences, because eventually, if we are going to pass a law, the House and Senate have to agree on the exact same language, right down to the punctuation marks.
Yep.
We pass the law, we send it to the governor. The governor, using her executive branch power, checks and balances, can sign the law, sign it into law. The governor can't veto it. The governor can say, bad idea, I don't like it, legislature. The governor can send it back with an amendment. The governor can say, I like your idea, but I think there are ways to make it better. Sends it back with an amendment. We, in the legislature, if the governor does not sign it, we have the ability to override the veto, to say, sorry, governor, I know you don't like it, but we like it and we want this to be law. That requires a 2/3, a supermajority vote.
Yep.
Or we will consider the amendment that the governor filed, and we will either accept or reject the amendment and send it back to the governor. So it's a long, deliberative process, as it should be.
Yeah, it is. And it's interesting that I think most people don't realize that any citizen can potentially file a piece of legislation, which is really
Our
cool.
Constitution guarantees the right of citizen petition to the legislature. Our Constitution also prescribes a method to get a referendum question on the ballot, and we've seen a proliferation of ballot questions recently. I believe there are like 40 of them in the process for the next state ballot. And so there is plenty of opportunity for all citizens to participate in government.
Right. So as we mentioned in the intro, you're the chairman of the Senate Ways and Means Committee. We hear that term a lot. Can you describe what does Ways and Means mean, and what is the duties of that committee?
So it's arguably the busiest committee in the State House. The Senate Ways and Means Committee is responsible for any piece of legislation that has a fiscal impact upon the Commonwealth. Arguably, 95% of what we consider in the legislature has a fiscal impact one way or another on the Commonwealth, so it all flows through the Committee on Ways and Means. It's a very big committee, not only as far as power and the fact that we have our fingerprints on pretty much every single bill that works through the process, but also I have a big staff, the largest staff in the State House. I have 11 fiscal analysts. Each fiscal analyst has a portfolio of accounts that he or she are responsible for. Someone could be, I'll have a fiscal analyst on education, whether it's K through 12 or early ed or higher ed. There's a fiscal analyst responsible for public safety. There's a fiscal analyst responsible for environmental affairs, for the judiciary and the trial courts. And there are resident experts on everything financial, fiscal, budget related to those portfolios of accounts. Then we have a team of 5 attorneys. We are writing laws, so we need lawyers to help us draft the law to make sure the way we're drafting the law complies with the Constitution. The way we're drafting the law actually addresses the issue we're attempting to address. We spend a lot of time meeting and talking to all stakeholders on a particular piece of legislation we're passing to ensure that there are no unintended consequences by passing this bill. So, and again, our attorneys are broken down by subject matter expert. Each of our counsel has a portfolio of accounts that he or she are the resident experts of those accounts. So it's a very busy committee. I'm proud that, the biggest piece of legislation we work on every year is the state budget.
Right.
That is a bill. This year was $61.01 billion. It's the largest operational budget of any organization in New England by far. Think about this. It's about the same budget as UPS Corporation.
Wow.
And we do it with 11 fiscal analysts. UPS probably has 11,000 fiscal analysts in their corporation.
Yep.
And this was the 7th budget that I've led the Senate through, which is a record.
Wow, it goes by quick.
It goes by quick.
Or maybe not.
seven budgets, including 2 budgets through COVID.
Yes.
So it's been a wild ride. And I've been lucky that my partner in writing these budgets is Chair Aaron Michaelwitz from the House. He is to the House of Representatives of what I am to the Senate. And he and I have written 7 budgets together, countless supplemental budgets, countless bond bills, countless other pieces of legislation where he and I have served as the point person on shepherding this legislation through the legislature and onto the governor.
Yeah, and it seems like you two actually have a pretty good relationship. You're always joking with each other, it seems like, in different press conferences and at the podium.
He's an amazing guy. He's younger than me. He has a different perspective. He represents his branch, the House of Representatives, really, really well. He does a great job representing the House. I like to think I do a great job representing the 39 other members of the Senate. We have different priorities. We have different perspectives. He is the point person. He's number 2 in the House under the Speaker of the House. I'm number 2 in the Senate under the Senate President. So he has a boss. I have a boss. So we have to ensure that as we are at the bargaining table and the negotiating table, we represent who we're supposed to represent. At the same time, we have the world of respect for each other, knowing that at the end of the day, we have the same goals. We are trying to get to the end. We are trying to get something done. We are trying to ensure that Massachusetts is the best place to live and to work and to raise a family. We enjoy each other's company, and not to say we don't have our moments. We've had our knockdown, drag-out conference committees. It's been well publicized. But again, at the end of the day, we get it done.
Yeah, absolutely. And we touched on the budget process a little bit. Could you go into a little more detail of kind of what the budget process is, what it means to balance a state budget? Unlike the feds, they don't really need to balance a budget.
No,
and then also how a supplemental budget kind of fits into that as well.
So the life cycle of a state budget is long. It starts in December. On December 4th of 2024, we had what's called a consensus revenue hearing, where I, leading the Senate, Chair Michaelwitz leading the House, and Secretary Matt Gorkowitz, who's the Secretary of Administration and Finance, representing the governor. He is the point person to the governor on all things budget. That we convene a meeting and we bring in a bunch of experts, individuals that we like to call our talking heads. We have a number of very high-level, smart economists in Massachusetts. We bring in the Federal Reserve. We bring in the Department of Revenue. We bring in people like Dr. Michael Goodman from UMass Dartmouth. We bring in Dr. Alan Clayton Matthews from Northeastern University. We bring in all these people whose life is looking at the economy and the impact that it's going to have on state revenues. And we arrive at what's called a consensus revenue figure, where the House, the Senate, and the governor all agree this is how much money we're going to have in the following fiscal year. Keep in mind that 7 months begins 7 months down the road. This is in December of 24. The fiscal year did not start till July 1 of 25. So we're forecasting.
Yep.
The governor then files her proposal based upon that consensus revenue number. It's called House 1, and that kicks things off. So the governor files her budget. I always say, and I'm on my 7th governor, Democrat and Republican, irregardless, a governor's budget is more of a political statement than a practicable document.
Okay.
Meaning that the governor can file her budget built upon assumptions, assuming, and we've all agreed that this is our consensus revenue, but also assuming that we pass the tax increase that he or she proposed, assuming that we pass the tax cut or he or she proposed. This is how they would spend that money. It then goes to the House of Representatives. Our Constitution requires any quote-unquote money bills originate in the House. and sometime mid-April, the House of Representatives will pass their budget. It then comes to us in the Senate. By the end of May, we in the Senate will pass our version of the state budget. There's a lot in between there. The Ways and Means Committee, both House and Senate, will first start by putting out a recommended budget. This is how we in the Ways and Means Committee recommend we spend this $61 billion.
Okay.
Every legislator, every member of the House, every member of the Senate has the ability to file amendments, to amend that, to say, we have a better idea. This is our better idea. And we debate all those amendments.
Okay.
We get like 1,200 amendments filed to the budget. So it's, when we're in quote unquote budget week, it literally is a week plus round the clock amendments and negotiations and considerations.
And the budget you've written at that point already matches the projected revenue.
We do not build budgets on assumptions. We build budgets on facts.
So then all of those
proposals
yes,
don't count.
correct. Yeah, okay.
Unless we agree with those proposals
Yep.
and we build them into, because we're passing a law. She's proposing a law. We're actually passing a law. So at the end of the day, when the House passes their version of the budget or the Senate passes our version of the budget, it is balanced.
Okay.
There is enough revenue to cover what we're spending.
Okay.
Then again, the governor has the ability to literally line item veto, go through the budget and strike what she or he, it's a she now, Governor Healy, what she doesn't like and veto it. We have the ability to override the veto. So it's really a dynamic, nonstop process. We still have not put fiscal year 24 to bed.
So, yeah, so talk about that, because is that where supplemental budgets come in?
Correct.
Okay.
So, not for fiscal year 24.
Okay.
For fiscal year 24, there's one budget left.
Okay.
It's called the closeout supplemental budget.
Okay.
So the fiscal year ended on July 30th. Bills due from FY24 trickle in after July 1.
Okay.
Accounts, as they get squared, find out there might be deficiencies in those accounts.
Okay.
So we have to close the books in FY24, meaning we have to pay or not pay all prior year's bills, and we have to reconcile the books. We have to do that by October 31st. So we'll be doing that in October.
Okay.
And so that will put fiscal year 24 to bed. We are now 2.5 months into FY25. So we are already beginning passing supplemental budgets for FY25. There's always supplemental. Things change. You can forecast 7 months down the road. You never get it right.
Right.
You hope you're on the right side of wrong, meaning that actual revenues are coming in above estimated.
Yep.
And we have benchmarks that we follow monthly. Not always the case, right? So we have to adjust as we go constantly through the year. We just passed a major supplemental budget yesterday. We have more supplemental budgets coming up. So budgeting is, it's not like you pass a budget, you put it to bed, see
Right.
you next year. It's constantly ongoing through the year.
Yep. So speaking of that legislation that you passed, or through the Senate at least yesterday, could you tell us about that? A healthcare spending package, correct?
Yes, absolutely. So it actually passed both the House and the Senate.
Okay.
I and Chair Mikowitz engaged in a multi-week conversation and negotiation of a supplemental budget to help our hospitals and community health centers. In Fall River, think of STAR, think of Health First, think of St. Luke's Hospital, think of St. Anne's Hospital, think of Charlton Memorial Hospital. So our hospitals and healthcare providers are under tremendous fiscal strain for a number of reasons. Yeah. One of which is inflation. Healthcare inflation is rising much faster than general inflation, 10-12% in healthcare inflation. The cost of prescription drugs, just the cost of healthcare services, wages, as you know, healthcare professionals, nurses, those that work in healthcare, their salaries are rising. So in addition to that, there's major cutbacks in support from the federal government. Massachusetts is very reliant on something we call FFP. Not just Massachusetts, every state in the country is very reliant on Medicare. Major cutbacks are coming in Medicare, which means that the reimbursement rates, the support from the feds is drastically dropping, and it puts a greater burden on our healthcare providers. So we did pass a major supplemental budget yesterday to help our hospitals and our community health centers, and it's going to be the issue going forward. The cost of healthcare, the cost of health insurance premiums, which is different than healthcare, but it's still under that umbrella of healthcare, is rising.
And it seems like that will impact communities like New Bedford and Fall River here on the South Coast, maybe more than other areas in the state, depending on that payer mix and the users of the system.
Correct. So in gateway cities like Fall River and New Bedford, and you can go to Lawrence, Lowell, Holyoke, Brockton, right? There are many individuals that do not have private health insurance, even though Massachusetts has the highest percentage of its residents insured health insurance through private. There are still many that aren't. And public paying, whether it's Mass Health or Medicare, does not pay for the full cost, does not reimburse a hospital for the full cost of services in many times. So the hospitals have to eat that. And there's only so much they can eat, before they're in real trouble.
Right.
So absolutely, our gateway cities, those hospitals that service the large number of uninsured, underinsured individuals, public pay, that have public insurance on Mass Health or Medicare, are under great stress and strain. The package that we passed yesterday help provide assistance to 44 hospitals across the Commonwealth, including South Coast hospitals, including which now Brown University Health,
right.
St. Anne's and Morton, including those hospitals.
Well, that's great, and I'm sure our friends at South Coast and Brown are very thankful.
I saw many of them last night at an event, and they were very thankful and appreciative. I said, "Are you happy?" And they're like, "Well, we're relieved."
Yeah.
Are we happy? No one in the health provider industry right now is happy because they see what's coming down from the feds with these cutbacks. Big decisions are going to have to be made.
Yeah, and of course, we focus on kind of the healthcare that we receive. That's where our mind goes first. But both of those, or including the community health centers, are large economic drivers. And the largest South Coast Health is the largest employer in the region.
And it's not unusual in Brockton or Lawrence or Holyoke, you name it. They are the largest employers in the region, so that they're an economic driver in the region. And we're lucky. We have great leadership. I believe very good leadership, fantastic leadership in our South Coast Health, from Charlton to St. Luke's to Toby, Brown University Health now. I mean, we had issues and problems with Stewart Healthcare when, again, private equity should never be allowed in healthcare delivery, but it still is in some cases, not here in Massachusetts anymore.
Well, we're glad to be on the other side of that crisis at least. Me too. But there's certainly some clouds, it looks like, in the future in the healthcare world. So, I mean, you've talked about 7 budgets, is that right?
We've written 7 operating budgets, countless supplemental budgets, countless bond. But what's a bond bill? A bond bill is a budget authorization for capital spending.
Okay.
You'll hear transportation bond. That's where we authorize the borrowing, because a bond, you borrow money, authorized to borrow money to build new bridges. What's going on Route 79 is paid for through the transportation bond bill.
Okay.
We have higher ed bond bills where we build or make improvements to our public higher educational institutions. We have environmental bond bills where we make capital expenditures to improve the environment, dredge rivers, purchase open space, stuff like that. I have no idea how many budgets I've done.
So 7 years though, as the chairman. over those years, I'm sure the priorities have shifted. I mean, you went through COVID, so things change. What would you say currently is 2 or 3 of your high priority or focus areas right now?
In the budget world,
Or just in general?
in the budget world, it's definitely healthcare.
Yep.
Healthcare, 40% of the state's $60 billion budget is healthcare. Wow. 40%. So that is, and it's very complicated. You have, first of all, patients that get healthcare services. You have providers, hospitals, doctors. You have insurance companies, intermediary. Massachusetts, like the rest of the country, doesn't have a single payer system. It's multiple payers. Every health insurance company, whether it's Blue Cross Blue Shield or Harvard Pilgrim or you name them all, have different payment methods, different reimbursement rate. It's very, very, very complicated. So in the budget world, it's absolutely healthcare. In the policy world, I like to say that in Ways and Means, I'm in the now.
Yeah.
Because there's so much coming at us, we can only concentrate on what we're into now. Last week was healthcare. This week is data privacy.
Yep.
The Senate reported out of committee, Ways and Means Committee, yesterday, a major data privacy bill ensuring that yours and my personal data that has been collected by insurance companies, that's been collected by higher educational institutions, that's been collected by anyone that you do business with, cannot be sold, has to be protected. It was Amar Patel is my general counsel in charge of data privacy. He's been working on this for 4 months, has taken a record number of meetings with stakeholders, Verizon, the New England Cable Television Administration, Mass Hospital Associations, the Mass Higher Educational Institutions, to try to ensure that these entities can continue to do business and can continue to provide services, but they are not collecting data or information that is not reasonably required for them to provide their service, and that they're not selling that information or profiting from that information to other vendors that would love to know where you do all your shopping, would love to know, all your personal, where you do your banking, would love to know that. We feel very strongly that's none of their business, right? Yeah. The cat's already out of the bag on many of those. This is really an issue that should be handled federally because, we now go online and do business. When we go on to Amazon, they were just a pass-through reseller. You're doing business around the world with them. Yep. It really should be done on a federal level because what we don't want, what the business community is afraid of, is that we're going to pass a law in Massachusetts that's so unique to Massachusetts that would cause them to create a whole new level of rules and regulations just to do business in Massachusetts that they don't need to do in 49 other states. Right. So we think we got it right. Yep. So far, I'm getting thumbs up. Good.
We have heard about that a little bit. I know there was some concern early on about, that hot topic word, competitiveness, and making sure that, it doesn't make it tougher to do business here in Massachusetts. But I'm excited to hear that.
So it's balancing the need to protect our citizens' public, personal, private information and data, protecting them, balancing with the need that we do live in a global economy, and making sure that Massachusetts stays competitive in that economy, and making sure that the businesses that are from Massachusetts remain competitive and have interoperability throughout all of their client base.
Yeah. So I want to talk about one more thing because so far we've talked a lot about kind of statewide issues with your position as chairman. One really neat initiative that I saw you took on recently was kind of a district-wide tour. You went around to different communities, it appears, and talked to different local leaders and constituents. How can you tell me a little about that and what that was like?
Absolutely. So as chair of Ways and Means, I am literally in the State House every day, all day, right? It's not a job you can do remotely. It's not a job that you can only go in once or twice a week when you're in session or when you have a committee hearing. I don't leave for lunch. I sit, I brown bag it, and so that's the good news, right? I love the fact that I'm involved in all that. The bad news is I'm not here in the district a lot.
Right.
I am out of sight. I don't want to be out of sight and out of mind. So the month of August, which is a recess in the legislature where we don't have any formal sessions, I took that opportunity to meet with every community I represent: Westport, Fall River, Somerset, Swansea, Freetown, Lakeville, and Rochester. And I hosted a lunch. Maybe it's my cultural, I like to break bread, and I like to sit down around a table and have a working lunch. And I invited every local municipal official: selectmen, school committee, school superintendent, police chief, fire chief, dog catcher, planning board, wide net. And we just had lunch for a couple hours, and we talked about what's important, and I learned a lot. I learned what the priorities are, because Rochester is a lot different than Somerset.
Yeah.
Lakeville is a lot different than Swansea.
Right.
They're all different. They all have different priorities. Some have regional schools, some have individual schools, some have public water, some have private drinking wells and septic systems. Some communities are very concerned about their pond levels.
Yes,
Long Pond in
right,
Freetown and Lakeville.
Freetown,
And
my hometown.
Somerset's very concerned about the redevelopment of Brayton Point and the reestablishment of a real local tax base in its town. Swansea's trying to revitalize the Swansea Mall on a commercial level, and they're putting water and sewer in. Every community's different. So it was a lot of fun.
Yeah.
And it was an ability for me to hear firsthand from my communities.
Yeah, that's awesome. And I heard from several folks across the different communities that they had met with you. I saw it on social media. I thought that was such a great initiative and great idea of you to do. So, anyways, with that, I think we'll wrap it up. Senator, thank you so much for joining us today on the Policy Pulse.
It's my pleasure. If I could just one close, just to let all of the listeners know that those that know me know I'm an anal communicator. But I want to hear from my constituents, and I have, whether it's a phone call, a text, an email, stopping in. I have a district office in Fall River at the Government Center, at Somerset Town Hall. I have Maureen Flanagan as my district director. She's full-time, out and about, regular office hours, and we use our Council on Agings as where to have these office hours. But if you have a thought or a concern, reach out. We do get back to you, and we're here to help.
Absolutely, and I can definitely attest to that, Senator. Your office, you are always very available, always willing to help out with the constituents, with the chamber, whatever it needs. So we all thank you profusely. So with that, I'll close it out. Thank you all for joining us today on the One South Coast Chamber podcast on this today's edition of the Policy Pulse. Make sure to follow the show wherever you get your podcasts, and stay tuned so when we release new episodes, right away. Also remember to follow us on our socials on Facebook, Instagram, LinkedIn, and now TikTok at the One South Coast Chamber.